like the other RTCs, our goal is to increase knowledge and improve practice behavior for physicians and medical students and allied health providers around the prevention, identification, and treatment of fetal alcohol spectrum disorders. The best part, the best days really center around our clinical outreach. What was most striking to me, and is kind of this is why we're here moments, is as soon as they get the diagnosis, the complete relaxation and the, I'm not stupid, so I'm not stupid, it's not me. And really for the first time understanding that the challenges they faced in their life really wasn't them not trying hard enough, them not getting it, them being, their own words of feeling stupid, as much as not understanding. Us as a field not recognizing it until they were in their 30s, 40s, or 50s even. And then taking from that point on, and them identifying it as that's when they were born, and going on with their life with this new information. So those are the big aha moments, and where we can really step in and make a difference. And it's just such a compelling area, because on the one hand, one would think that we could prevent this. On the other hand, if we understand addiction, we recognize that it's really, really difficult. And that just saying no to alcohol is not going to work for the majority of the people that we try to serve. Well, at Great Lakes, we're particularly proud of a couple of our programs, and one is our FASD Training of Trainers Clinical Certificate Program, and that's an intensive 30-hour training program where folks spend the entire week with us. We teach them all the competencies regarding fetal alcohol syndrome, preventing it, treating it, identifying it. We've trained about 125 people in this intensive 30-hour course, and about 75% have completed and earned their certificate in FASD education. Each program has maxed out, and we've had a waiting list, so it's in pretty high demand right now. I think one of the biggest barriers in the field is little bits of information that hit the mass media. So we get calls all the time, as you can imagine, and when someone's calling saying, well, what do you say? This new study said it's okay to drink during pregnancy. It's like, did it really say that? Read the original research. And most often we find that that's not what it said at all. It reported on good evidence-based data. The media folks do their own conclusions. One of the other big challenges is the lack of diagnostic capacity around the country. Our goal is to reach medical and allied health providers, to train physicians so that they can do this diagnosis. I think for me that whether it's multidisciplinary or not, just increasing the skills so your average family practitioner, your average internist is able to make this diagnosis, pediatrician especially, is able to make this diagnosis on their own. In addition to that, we have an ongoing Foundations of FASD for physicians that Dr. Wargowski conducts. And the great part about that is when the training is over, you learn how to diagnose FAS. We actually end it with a live patient, with a family who couldn't otherwise afford medical care, comes in to get an assessment for FAS, and that assessment is at no cost to them. They understand that it's a training component for physicians, and it's really a win-win situation. And sometimes we get overwhelmed with how much work there is left to do, but when we look back in time, we've really accomplished a lot. So many more people understand about the effects of alcohol on the developing fetus. So many more physicians are asking about alcohol. We have a long ways to go, but I think that it doesn't stop us at all from being able to step back and appreciate how far we've come. And I can't imagine doing anything else. I've been doing it for almost 30 years, and it's much more than a career. It's really become part of my life.